Hello, this is Dr. Amrita Chakrabarti and I'm a hematologist at Max Hospital, Shalimar Bagh. I see all kinds of blood disorders, cancerous and non-cancerous blood disorders, including bleeding and clotting disorders as well.
Ma'am, what is blood cancer and what are the common types of blood cancer?
So blood cancer is the kind of condition in which there is an uncontrolled growth of blood cells within the bone marrow and which then eventually spills over in the blood, in the peripheral blood. Blood cancer can mainly be of three types: leukemias, lymphomas and multiple myeloma. Leukemia is the cancer of the white blood cells. Lymphoma is the cancer of lymphoid cells or the lymph nodes, which are found everywhere within our body. And multiple myeloma is the cancer of plasma cells, which are specifically found within our bone marrow, which is the blood forming organ of our body or the factory where blood is made. So the treatment for blood cancer depends on the kind of blood cancer we are dealing with, whether they are acute or chronic in nature, whether they are slow growing or fast growing, they are aggressive or they are indolent, and what exactly is the characteristic of the kind of cancer cells that we are dealing with. So mainly we treat blood cancers by a number of options we have. So very slow growing cancers or chronic ones, sometimes we prefer them to just observe and not treat them. But in case of acute leukemias or higher grade lymphomas, we prefer to treat these kind of cancers. So the treatment of blood cancers will include chemotherapy, immunotherapy, certain targeted therapies, and also we can use radiation therapy at times. Finally, in certain eligible cases, we can go ahead with the option of bone marrow transplant, which we can use it as an autologous transplant or an allogenic transplant, depending on the diagnosis and the treatment that the patient has earlier received.